Cardiovascular diseases, cardiovascular diseases. Good morning, wherever you're watching us from, and you're welcome to yet another episode of Mr. Selfcare Live every Sunday morning. And today we want to share something very important. Definitely, we are privileged to have you every Sunday morning watch with us. Thank you so much for always keeping it here, and thank you so much for always choosing to be every Sunday morning to learn something new about your health. Today is a special day. We are having a special person in our studios, and we are going to talk about something very important. Many of us, our lives, or all of us, our lives are just like a car. It has a beautiful body out and something inside that we always don't look at, and yet very important. In a car, it's called the engine. In our lives, it is called the heart, the human heart. So many times, so many people talk about the heart when we have emotional things. But unfortunately, the heart does other things apart from actually those that we think it does. And in this studio today, we are having an expert all the way from Uganda Heart Institute that is going to educate us on how to take care of our heart using simple procedures that can actually be done at home. He's a great friend of mine. He's a Christian, a born-again Christian, a very amazing person. And me and you are so lucky to start our day and new month with learning about our human hearts and how to take care of this very important organ. Friends, join me as I'm about to introduce Mr. Charles. Remember, this program is for someone that wants to protect their heart. This program, it goes to someone that is having cardiovascular issues and you're wondering what you can do to reduce the effects or to slow down the progress of the disease. This program is for parents who are having obese children and you're wondering what you can do to prevent them from having heart or cardiovascular related issues. This program is for someone who was diagnosed with cardiovascular problems, but you're looking for ways on how to live with the problem and yet living your normal life. Ladies and gentlemen, let's welcome Mr. Mulondo Charles, all the way from Uganda Heart Institute, as our panelist, and is going to be taking us through the next few minutes. Yes, Mr. Charles, good morning.
Good morning, Mr. Richard. It's an honor to be on this platform. You've never ceased to amaze me. Wherever you go, you always want that connection to the people, and which is a great feeling and a great cause for humanity. I'm proud of you. I know we are from far together. We are friends.
Yes.
To all the viewers, my name is Mulondo Charles. I am a born-again Christian.
Very important, very important.
Right away from Uganda. Professionally, I am a medical imaging technologist. This is someone who deals with the imaging facilities, like we all know, the X-rays, the CTs, the ultrasounds, the MRIs, to enable at least our fellow clinicians to manage diseases. I do my training and with Uganda Heart Institute. It is now coming to, I think, the 13th year I am with Uganda Heart Institute. Not only that, I am, because of the passion I have for physical exercises and sports, the institute deemed it fit to make me the sports and wellness coordinator at Uganda Heart Institute, which mandates me to at least come up with programs and plans for the staff of Uganda Heart Institute to at least have the best fitness levels to work properly for as they're attending to patients. And also, I'm a sports enthusiast. I really do lots of sports, and my schedule is full of physical exercises Monday to Sunday. Yeah, thank you so much. It's an honor to be talking to you. And today I was given this role to talk about cardiovascular disease management and in relation to physical exercises. How does physical exercises help us to manage the cardiovascular diseases? And before I go further, I would like to return the mic to Mr. Richard to tell me now how to go forward.
Thank you so much, Charles. And we are so privileged to have such an experienced person from you. As a Christian, Charles, what's your favorite verse in the Bible? I always start with that.
It's a story in Numbers 14
Yes.
about two young men who, in the names of Caleb and Joshua, and actually it was my inspiration to name one of my children Caleb Joshua Mwesigwa. It's a favorite story whereby God sent some people, Jews, to spy a land, but out of the 12, 10 saw the negativity, but only two saw beyond the human eyes and saw the good things God has kept for them. And they pursued and they got them.
Wow. We shall come back to that story. I always want to start with my visitors. Icebreaker is just start with asking them about their favorite verses in the Bible. And Charles, we are so happy to have you here talk to Ugandans about cardiovascular diseases. How is Uganda at Institute? We are
Uganda
seeing there is a construction going on. Very good news happening around Uganda at Institute.
we are so grateful, not only to God, but also to the people He's using to see that Uganda attains a world class cardiac center that is being constructed at Naguru, and we are progressing so well. We hope, God willingly, by 2027 we shall be ready to go. But before that is completed, we are making such progress in taming down cardiovascular diseases by really getting into practice of high level of cardiovascular management. Each
Wow.
and every clinician is getting to be super specialized so that we can take care of Ugandan patients, and not only Ugandan, because we are now more crossing even the borders. Most
Yeah.
of the East Africans are coming in, most of the West Africans are coming in, most of the South Africans are coming in. Not only just to be seeing what we do, but also to treat their patients.
Wow.
So we recently have developed, we have got a new state-of-the-art catheterization lab to help us in managing certain procedures. Yeah, but as far as that, we are doing lots of research also so that we really have the best treatment to our patients. Thank you.
Wow. That's very good news from Uganda Heart Institute. And again, we want to thank all the funders, the government of Uganda, and all the other funders that are giving in money to make sure that Uganda Heart Institute is facilitated to take care of all Ugandan hearts. Thank you so much, Charles. Back to the topic of discussion. What
Yeah.
are cardiovascular diseases in simple
So,
terms?
first and foremost, our viewers must know that one of the most crucial parts of our bodies, the heart and the blood vessels that are connected to the heart. Because like a car, we have an engine, and that engine is the one that propels the car to do anything you wish to. And this must coordinate with the brain to see that the body works well. So when we talk about the cardiovascular diseases, we are talking about not only the heart diseases, but also the blood vessels which are connected to the heart. So when we talk about the cardiovascular diseases, we are talking about any disease that hinders the heart from working well, and the blood vessels also from supplying the blood well towards the heart and away from the heart. So that is about the cardiovascular diseases. And in most cases, usually it pertains uh, the clots. There's what we call clots. These are fats which clog or lodge in the heart or the blood vessels that reduce the blood from flowing well towards and away from the heart. But also sometimes they can cause sudden breakage of flow of blood. In Uganda Heart Institute, we see lots of heart attacks. We see lots of people who come with sudden chest pain, and when we go and assess, we find that they have these cardiovascular diseases. There are so many types of cardiovascular diseases, but probably I will mention the two most important. We have the
Yes.
coronary heart disease. This is the disease that attacks the muscle of the heart,
Okay.
and it is usually caused by either reduced blood flow in the muscles or sudden stoppage of the blood flow in the heart. And suddenly you see someone just falling down. We've had stories where someone is in the bathroom and suddenly he just falls down and never comes up because of a heart attack. And there are so many examples of coronary heart disease. But to mention, there's what we call angina. Angina is where you get chest pain because blood is not flowing well to the muscle of the heart. We also have heart attacks where the blood flow to the heart suddenly stops. And
Okay.
also we have what we call heart failure, whereby the heart doesn't supply blood very well to other parts of the body, so it is not sufficient enough. We also have another type of cardiovascular disease which we call peripheral vascular diseases. These ones attack the blood vessels that take the blood away from the heart to other parts of the body. And they are characterized by people coming in, especially they affect the limbs, can be the upper limbs, it can be the lower limbs. So someone can come with sudden pain in the leg, there's those cramping. Someone feels numbness in the legs, doesn't feel the sensation in the leg. Someone has this ulcer or wounds that are persistent, they are always there. Then another type of cardiovascular disease, I mentioned two, but maybe I add up the three, is what we call aortic disease. There is this big vessel, very big vessel that takes the blood away,
The aorta.
the aorta. So there are certain cases whereby a person comes with a very enlarged heart, enlarged aorta, what we call aortic aneurysm,
Yeah.
which impinges on the flow of the blood, and it has repercussions. So all these are part of cardiovascular disease.
Yeah. In fact, one of the most dangerous surgical emergency condition we normally have is in cases where it ruptures, where
Yes.
if people actually, if it doesn't happen in a setting where it can be taken care of, we've had so many people lose their life due to immense blood loss. So,
Sure.
Charles, thank you so much for giving us that history of cardiovascular disease. I believe our viewers out there have properly understood the topic we are going to talk about. So when we talk
Yes.
about cardiovascular disease, we mean the heart and the vessels that carry blood from the heart, the arteries, but also those that carry blood towards the heart, which are veins. So
Yes.
Charles,
Yes, my dear.
going back to the topic, how do regular physical exercise improve the functioning of the heart?
Now, remember earlier on I mentioned that the biggest factor that bring the cardiovascular disease are the clots
Mm,
that lodge in these tubes. These blood vessels, they're just tubes that
mm,
have that blood flows to and fro from the heart.
mm,
They get the blood from the heart, and also others get blood from other body parts to the
mm,
heart. Then something, the process continues like that.
mm.
So we in an era whereby we want to do more of
Okay. I think Charles is having some internet glitch, but he should be back in a short while. Friends, today we are talking about the human heart, and we are discussing how we can take care of the human heart using physical exercise. Um, it is unfortunate that sometimes we're having people suffer due to things that actually are preventable. Did you know that just by physical exercise, each time you do physical exercise, actually you prolong the functioning of your heart? Each time you exercise, you prolong the capacity, you prolong the lifespan, you prolong the functionability of your heart. So today we are privileged to have an expert from Uganda Heart Institute, Charles, who has been there for the last 13 years, talk to us actually about how they are using now exercise to, number one, to improve performance of the human heart, number two, to improve performance, but also number two, to prevent and control cardiovascular diseases and any related diseases. Definitely, we know it's going to be a very good discussion that we are going to have this morning. And if you know someone that is suffering from heart-related issues, or someone that has been diagnosed recently, or if yourself you're worried about that, please step back and watch the entire program. And I believe by the end of the discussion, you will have solutions to whatever you're worried about. Again, I want to welcome people that are watching for the very first time today. You're most welcome. Please, I kindly remind you to subscribe, to comment, and to share this video with everyone that may benefit from this. There are so many diseases of the heart, like Charles has put it. Some of these diseases attack the heart itself and reduce its functionability. Some of them attack the blood vessels that take blood away from the heart, while others attack the veins that bring blood back to the heart. But in all ways, we are exercise can help to solve all these related issues. My friend has gotten some technical glitches, but he should be back in our studios in a short while. So whatever you want to do, always make sure you take good care of your heart. Charles, you're welcome. We can proceed.
I apologize. Something a technical problem with my phone,
It,
and it went off.
it's okay.
Uh,
The devil is always on a fight.
so I was still talking about the cardiovascular disease, and
Yes.
when you look at the statistics of World Health Organization, you
Yes.
realize that it is one of the top leading causes of deaths.
Mm,
And according to WHO, World Health Organization, it
mm.
caters for 17.9 million people deaths
Oh, wow.
in the
Wow.
whole of the world. And
Yeah.
if it is not tamed, then
Mm.
the stats will increase.
Yes.
So
Yes.
you were asking me why physical exercises are very crucial to the management of the cardiovascular disease.
Yes.
Now, physical exercise is just any movement, any deliberate movement,
Mm.
intentional movement of the
Mm.
body
Mm.
for a certain objective.
Mm.
So we know that the crucial part in cardiovascular disease are the
Mm.
clots. And
Mm.
these clots are brought about by certain fats which are not needed in the
Mm.
body.
Mm.
And this is what we call bad cholesterol.
Mm.
In most cases, for especially the clinicians, there is always they want to ask for lipid profile, where they
Yes.
want to check the levels of the HDL, high
HDL.
level
Mm.
lipoprotein, and low density lipoprotein.
Mm.
Where if the low density lipoprotein or LDL is high, you know that you have bad cholesterol. Now, this cholesterol, this fat called cholesterol, is the one that causes, is the major cause of the clot. They come and attach to the walls of the blood vessels and also the heart, and they cause a blockage to the flow of the blood, or sometimes completely seizes the movement of the blood by complete blockage. Now, what exercise does is evidence based that whenever you have that intentional movement of the body, you reduce on the formation of these clots or this fat in the body. And we realize that most of the people who have who are highly susceptible to the cardiovascular disease are ones who are obese. This is being fat. Uh, if I can use that word, I know it doesn't look it doesn't sound well to some people, but there are those people who have weights that are beyond what the body can handle.
Mm.
And in most cases, it is because of a collection of lots of fats, and
Mm.
these fats now make the blood vessels and the heart susceptible to these clots.
Mm.
So what the physical exercises do.
Mm. Wow. Uh, Mr. Charles again is disturbed by the internet, but he should be back. He was actually stressing a point on the importance of physical exercise and how it helps us to control cardiovascular diseases. Again, if you're here for the very first time, we welcome you and thank you so much
Mr. Richard,
for yeah you're on
Mr.
again.
Richard,
You yes, please.
Mr. Richard,
I can hear you.
Mr. Richard.
I can hear you, Charles.
Hello.
I can hear you. Yes, Charles. I can hear you, please.
Mr. Richard, can you hear me? I'm trying
I,
to. I don't know
I
what
can hear.
happened to.
I can hear you very well.
Okay, and also my viewers, our viewers, can they see?
But the video is not showing us. It's showing me. Okay, I can. Yes, you're clear
Okay,
now.
so
Yes.
yes. So what the physical exercises do in the management of the cardiovascular disease, that they lower the blood pressure. We've talked about obesity, and this
Yes.
obesity also is associated with the high blood pressure
Yes.
when pressures go beyond the normal. And
Mm.
also they are associated with type 2 diabetes. So all these are risk factors to the cardiovascular disease. And
Mm.
what exercises does to help the cardiovascular management is they first of all lower the blood pressure
Okay.
if it is high. Then they
Okay.
improve on the lipid profile. We've talked about the low density lipoprotein, which is the most cause of the bad cholesterol.
Mm.
So the exercise does regulate that.
Mm.
It helps the body not to gather that bad cholesterol.
Mm.
And also, we also see that in type 2 diabetes, it mostly zeros on the insulin levels of the body.
Mm.
So
Mm.
what the exercises does is that it enhances the body in insulin sensitivity,
Mm.
whereby it keeps it in check.
Mm.
It shouldn't go beyond what is supposed to be, that would bring this type 2 diabetes, and
Mm.
which is it's a sister to obesity, it's a sister
Mm.
to high blood pressure. Also
Okay.
what
Mm. Yes, Charles.
also what physical exercise it does is that it helps the body, it helps someone to reduce the weight,
Mm.
the bad weight that would really bring up all these problems. You see, when you are overweight, you become a hub or a house for all these diseases, which
Mm.
can put you in a risk of getting cardiovascular disease.
Okay.
Yes.
So, Charles,
Yes, my dear.
you've talked about a lot of exercise. You've explained to us actually the importance of this exercise. You said number one, they lower the body fat. They will somehow burn out the fat, and burning out the fat, the body gets rid of excess fat. But also you say they lower the tendency of collection of the bad fat within our body, which we call cholesterol, which
Yes.
cholesterol actually is responsible for a lot of cardiovascular issues. Now, what are some of the exercises that are recommended? Because Charles, we are in an era of so many exercises, right? From
Yes.
our bedrooms with our partners to walking to doing a lot of things.
Mm, mm.
I used to speak to friends of mine about exercise, and they would say, but me, I work a lot in my office. I move from here, I move from there. But then your definition of exercise, you said it must be intentional activity that
Yes.
you do. Charles, can you, before you take us to the types, can you differentiate for us when you say intentional and what is not intentional? Does my physical exercise, like for example, a person who goes around, for example, a farmer in the village who digs
Yes.
from morning up to maybe midday, is that considered intentional exercise? Or on top of that, I must also add maybe intentional walking. Can you throw more light about that?
Okay, we had. I hope this debate I had with one of the staff of Heart Institute will
Yes.
answer this question. We had a debate, and this person told me, I move upstairs, up and about. In a day, I can really do lots of exercise by moving. And I said,
Yes.
yeah, that is okay. That is part of the exercises,
Mm.
but it is not intentional, because that is part of your work. The
Yes.
body has gotten news that that is part of your work. You should move here and there, or you should do
Mm.
this and that. You should move the arm when you're using the computer. that is what the body has been subjected to do. But when we talk about physical exercise being intentional, is you are making a deliberate effort to move your body with certain intensity in order to stop a certain rise of an abnormality in your body. In this case, a disease that may affect the heart and the blood vessels. Point in case is you come to work, you probably your BMI body mass index is higher than normal. You've come, you've been employed in a workplace, and then you start working. And this working involves you moving probably about 3 kilometers, and your body is used to that. Your body is used to that. But when we talk about intentional physical exercise, that you want to put a progress that this, in spite of me moving 3 kilometers upstairs and down, and maybe moving from one area, one location, one point to another, but let me put about 30 minutes of probably high intensity motion of my body, so that at least I can achieve maybe a weight loss of 1 kg or 2 kgs. So that is what we call intentional physical exercises.
So, in other words, what you call intentional is that somehow this exercise has to be connected with the brain must know that now we are going to do exercise, and maybe somehow some hormone somewhere are regulated. Because I was also phased out to see that you see some people who like do manual labor or manual work. They
Yes.
carry heavy stuff, they move a lot, but then some of them actually put on extra weight. So you're clearly telling us that when it comes to a physical exercise, they must be intention. You must be
Yes.
intentional. And
Yes.
actually, I believe this is where a majority of our women get it wrong. Because each time we talk to them about exercise, they will be quick to tell you how they do a lot of things at home, how they move there and then. And most of the time, they give it as an excuse for them not to go for actually physical exercise. Mr. Charles, what are some of exercises recommended for people that actually can help them to cope up with cardiovascular issues?
Okay. So we are talking about two types of people here. People who do not want to get cardiovascular disease, and people who probably have cardiovascular disease, but they want to manage it or completely reduce it.
Yes.
And it has been proven that worldwide, one of the best preventive and also inexpensive yet friendly management plan is physical exercises. And we have about, I will talk about three types of physical exercises. There's where what we call aerobics exercises, whereby there's walking, cycling, swimming. It involves your heart to move at a certain rate within a certain period to at least get the benefits of it. But also we have what we call resistance training. This incorporates the strength and conditioning exercises, whereby it improves your strength, but also it helps the metabolism of your body. Then we have what we call flexibility physical exercises. This involves now stretching certain parts of the body so that they don't grow weak, or they don't grow susceptible to injuries whenever you're doing something.
Okay.
Yes.
So, throw more light on aerobics. My viewers want to understand, when you say aerobics, what do you mean exactly?
So aerobics involves you moving your a certain body part at a certain intensity within a certain time interval, and it will help the body. It will help the heart pump more blood to other body parts, and these ones will help different parts of the body to come to that point where they can work best.
What are some of the examples of aerobic exercises?
Like I've told you, we have
Mm.
walking. Other people call it brisk walking. It's
Okay.
like you don't just walk, but you make it
Mm.
intentional that I want to make maybe 5,000 steps. And these days, these phones have helped us, like iPhone, whereby they can monitor your steps, and these are intentional. You say
Okay.
today I want to make 5,000 steps, so that you increase the blood, the heart activity
Mm.
towards its function to supply more blood. Others, they can do cycling.
Mm.
Others, they can do swimming.
Okay.
Others can go and make efforts playing football, intentional.
Okay, Charles, talking about walking, I'll mainly talk about walking because this is affordable. You see, this program, I'm happy my mentor, my friend Chamagero Andrew is watching live. He's always one of those people that always told me when you're in this program, let us make it simple for Muntu Wants the lowest person. Now, talking about walking that is affordable literally by everyone. If my sister does not have an Apple Watch or a smartwatch, but they want to walk, what's the recommended duration or recommended distance that one can walk to achieve a daily target? For example, if someone in Mukono is listening to me and yes, they have their time to walk, but they don't have a phone to track it.
Yes.
Yes, averagely, what would you tell that person, like in terms of distance and all terms of time?
Minimum, at least minimum time of walking should be 30 minutes.
Okay.
30 minutes. Like our viewers probably who are in the corporate world, who
Mm,
in most cases they do lots of sitting and they
mm,
don't move. And when they leave their workplaces, they get into their cars and
mm,
they go home. In the morning, they also get into their car, come to the workplace. But when you make it intentional and you say, when I'm leaving home, probably my home is nearby, or
mm,
even if it is far, you use your car, you reach at your home a little earlier, or if your place, your neighborhood is safe, you can say, I will be doing 30 minutes of walk, intentional walking.
mm.
Yes. So minimum time at least 30
You can
minutes.
say, I will be doing. Okay. So thank you so much, Charles. That clearly says that, clearly informs us that people, everyone has a chance to do this walking. It simply means that actually, even if you're busy, I see my colleagues here, actually, my work policy or the people I see in the hospital, actually, every one of us, in the time we have students and employees, it is a must. At least you must take a break almost after seeing a patient, and you do some work around the facility to make sure at the end of the day you've achieved the targeted number of steps. Again, now for the friends in the corporate world, what is the targeted number of steps that I'm supposed to walk a day? Because like I have my watch and it tracks all my footsteps. So what is the targeted number of steps that I'm supposed to have in a day?
Okay, I may not be very specific in the number of steps one should make, but at least most of us know the way we walk, that we can now make it a point. If we've been walking slowly, you make at least paced walking to
Uh,
achieve.
Charles, one of our viewers saying our volume is low. So let us try to go a little bit high. Okay.
Oh,
So you were saying that you were still finishing a point on
yes,
footsteps.
I was saying, because personally I can make more than 5,000 steps in a day,
Yes. Mm.
and these 5,000 steps are paced steps, not just slow steps. So
Yes.
it may work for me, but it may not work for someone probably who is 120 kgs. So what one person does is that you just try to increase on the pace of your walking, at least to achieve certain portion of benefit to your body. And this is where now it calls for people, if you know your condition, like you are an obese person, it is best to get advice from professional people like physiotherapists. They can really come and tell you, you need to walk like this in a certain pace like this. Maybe within a week or two, you'll achieve this. Then, when you achieve that, then you will increase to this kind of walking, or even jogging, or even running. Hello.
Thank you so much, Charles, on that. Again, they always say that wherever there is an advantage, there is a disadvantage. So, Charles, do you know some of could we say that do we have what we call over exercising?
Certainly, yes. Certainly, yes. Certainly, yes.
Is there a
And
condition where someone says you've now over-exercised, and what could be the dangers again to the heart and the cardiovascular diseases? Because I know friends of mine who sleep, each time you go to the gym, you find them. Each time you check, like, especially those guys who walk around gym, the teenagers who want to put on bodies that they see in movies. Each time you
yes,
find them, they're on treadmills, they are carrying heavy weight, they are doing a lot of things. Do we have over prescription or over exercising, and how is it dangerous to the human heart and the cardiovascular system?
yes, there's what we call too much of exercising, and this calls for each one of us to first of all understand our bodies. If you are the first time starter of physical exercises, you must know and get certain prescription for people who are professionals in this. We have sports specialists, we have physiotherapists who you can go and tell that I want to begin physical exercises. My body is like this. What do I start with? Should I go for heavy metals, or should I do little of aerobics in terms of swimming, so that at least my body can reach a certain level, so that I can now start bringing weights? Other cases, even those people who have been training a lot, sometimes you want to increase on a certain level of exercises just suddenly, without subjecting your body through a certain process. So this is the best thing why certain gyms have coaches, professional physiotherapists who have become now trainers, who are there to advise us. Yes, there is over exercising, which need to be tamed, because they can cause, again, lots of dangers to our hearts and the body at large.
Okay, thank you so much. Some questions are starting to come in, and I will be reading them very, 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 very soon. Again, so you say there are exercises that are good for people who want to prevent heart diseases or cardiovascular issues, and there are
Yes,
also exercises that are prescribed for people who have been already diagnosed with heart problems.
yes,
Charles, can we talk about that group of friends that have already come to Heart Institute, diagnosed with heart problems? What are some of the exercises that are suitable for them? Uh, because, I mean, this is the heart that is sick. I
yes,
think definitely if I went to the gym and the guy told me to just carry maybe 200 kilograms on either side, maybe it is
mm,
endangering my heart the more. So what are some of these exercises that you
yes.
feel are safe for people with cardiovascular diseases?
Okay, now depending on the cardiovascular disease that you've been diagnosed with, which range from surgical procedure done probably on a heart that had problems since birth, to cases like clots in the blood vessels. Number one exercise that you can be told is walking.
Mm.
Increase in your walking. Try to avoid moving probably in cars. You may be having a big compound. You can make intentional effort to walk within your compound for a certain time, then you come and sit. Other patients, like the ones who are from surgery and they're just healing, they're in rehabilitation. They are told there are certain exercises of breathing the physiotherapists usually recommend for them. So all these patients with cardiovascular disease, there's prescribed exercises by the physiotherapists. Like at Heart Institute, we have a cardiac physiotherapist who recommends this.
Okay.
Yes.
Charles, um, talk about gyms today. There is a gym on every road now. And a lot of us actually, because either we are lazy to do this exercise at home, so many times we go to the gyms. And as an expert, I want to ask, how safe are gyms and exercises that they give to people vis-a-vis the recommended physical exercise that our bodies are supposed to receive? Do you think on an average we are getting the right directions in the gyms?
I must testify there's a great improvement in the gyms of today.
Okay.
In the gyms of yesterday and yesteryears, we used not to have people who are professionals, or even those who are not professionals. They didn't make an effort to at least get at least knowledge of what certain exercises should be prescribed to their clients. So most of these gyms are actually partitioned. There is where they lift weights and there is where they do aerobics from. And in most cases, they give, they guide most of their clients that, you know what, according to the way I look at you, you maybe begin like this. Begin from here, do 15 minutes of weightlifting and go 15 minutes or 20 minutes of aerobics. But also other gyms even have weighing scales and beep machines whereby they check. These people have become knowledgeable on what to tell their clients, because they have seen some cases where people have come and done gym and they die in their gyms because they were never tested. Someone was just compelled to come, and because a certain issue has come, he wants to go full board in the gym.
Yes.
Yes.
Charles, on that issue of the gym, there is an interesting case that actually I'm following up where a family is suing the gym for close to 2 million US dollars because they believe their father went there and he was subjected to exercise, and they believe it escalated his heart condition. What are some of the recommendations that you can give out to gym owners or instructors? What are some of the checklists that they are supposed to be looking out? Because some of us do not know that we are working with heart problems, because it is still a challenge for our population in actually testing for diseases. So what are some of the advice? I know this is a little off the topic of discussion, but as a person that works with cardiovascular patients every day, but also a sportsman and someone who loves exercise a lot, what are some of the recommendation or the safety measures or the precaution that you can give to the gym instructors on how to avoid legal issues with patients, but also on how to make sure that there is proper screening before a patient is subjected to any kind of exercise in their gym to avoid any related issues?
One thing I would first of all advise the gym owners is that have a professional person on board to
Okay.
at least assess each and every person who comes in. That should be number one. Number two is screen them. At least there are things which are cheap: blood pressure. Look at the have those weighing scales, and you measure someone's body mass index. Ask someone. Have probably questionnaires for those people who don't want to probably talk. Let them answer certain questions of, is it their first time? Is it that they have been doing exercises? What are their objectives? All these need to be noted. But also on the legality of it, maybe they should have also consent forms
Yep.
That
Very
this should
important.
be, there should be an agreement that should be signed on, that when
Mm.
you are doing these exercises, we are going to give you prescribed exercises.
Mm.
But when you go overboard, whatever that happens to you, we are not liable to it. So I would advocate for gyms to have professional people on ground,
Mm.
do proper screening, blood pressures, BMIs, at least those are basic starters for someone to come and start doing any exercises.
Okay.
And to the people who go to the gym, I would also
Mm.
recommend, before you do any exercises, like Heart Institute, we do have screenings whereby someone can come once in a year, come and know your condition.
Mm.
What is your level of fat in your body? How is your pressure? And you come and be open to your trainer. And you know what? That I've been diagnosed with this thing, and they
Mm.
recommend to do this and this and this. So it is a two-way. It is a two-way process.
Okay. So,
Yeah.
Charles, that takes me to another thing. What are some of the safety tips for someone that is already diagnosed with cardiovascular disease towards exercise? For example, if I am diagnosed with a certain heart disease, what are some of the safety advice you can give me while I do this exercise? Because sometimes in the need to, because we have it that when you're told you have high blood pressure or cardiovascular issues, the more you exercise, the better your life becomes. Now, sometimes we go overboard, like we talked about over exercising.
Yes.
So, Charles, what are some of again, what are some of the safety tips? What should I watch out for, that if I feel A, then I need to stop? If I feel like this, then I need to stop. What are some of the things that you could tell someone watching right now?
First of all, is what we talked about earlier.
Mm.
Before, if you have been diagnosed with a cardiovascular disease,
Yes.
first of all, seek your doctor's advice
Mm.
towards what type of exercise to do.
Okay.
And when you start doing that exercise, don't overdose yourself.
Mm.
Follow the instructions, and if you feel any funny or any abnormal feeling, point in case maybe increased chest pains, increased heart palpitations, seek out your
Mm.
physician and say, okay, I've been doing this, but I'm feeling this and this. Again, you get guidelines from that person. That would be the advice I would give for cardiovascular patients pertaining physical exercises.
Thank you so much. If you're watching out there and you own a gym, I would love actually soon to have a session with gym instructors or gym owners on this panel to talk about, to have a discussion around gyms. The same thing I'll do with people that own saunas. Because when you talk about these things, some people take it for granted. But I know so many low low cases now, so many cases in court that are coming because of people dying in gyms. Recently, in Cameroon, there is a footballer that died on the pitch. This foot guy died 10 years back, and last year, no, this year in February, his family has won against FIFA because he died in a FIFA tournament. Now, it does not mean that people over-exercise, or people who are small, or people who exercise every day are not supposed to go for heart checkup. Charles, soon you will tell us how often someone should go for heart checkup, but let's have this as well. Someone is saying, Charles, what are some of the tangible evidence that you professionals have proven that actually exercise help to improve cardiovascular issues? Are there some tangible evidences, research-based?
Research based, it has been proven that uh, people who have had cardiovascular disease
Yeah.
and they have embarked on physical exercises and they
Yes.
have come back for a recheck, at
Mm.
least there is 30% of reduction
Okay.
of the risk factors to the
Okay.
to either progress in the cardiovascular disease or subjection to more cardiovascular diseases.
Okay.
Yes.
Okay. So Charles, how often should one come for blood checkup, for heart checkup in a year?
Um,
And what is the procedure of this at Uganda Heart Institute for
what
someone
at Heart
watching?
Institute, what we do, we
Mm.
prescribe once in a year, come and check
Okay.
yourself, comprehensive checkup.
Okay.
We are going to do basic ones. We look
Yes.
at your blood pressure, we
Okay.
look at your body mass index,
Yes.
and we also look at your lipid profile. Certainly, you may find someone who is having normal body mass index, but he's having high cholesterol because of certain active habits that he's doing. You may find someone is alcoholic, maybe someone is a smoker, but for him, he says, my body is okay. Why do I have to exercise? Why do I have to go for screening? So all these are catered for. At least there are those basics that we do. But also we also provide educative sessions to someone: what to eat, what not to eat, what to do, what not to do to avoid these diseases.
And lastly, Charles, someone is saying, can you talk about the relationship between exercise and diabetes, hypertension, and obesity? How does exercise help people, number one, to prevent obesity, hypertension, and diabetes, but number two, those that have been diagnosed with those diseases, how will
Mm.
exercise help them to live longer and a more safer life?
Okay, you realize that what in most cases causes high blood pressure or diabetes is overweight.
Okay.
So what one of the things that the exercise does is it reduces your weight at least to acceptable number according to your body mass index. Body mass index actually gives you a hint on what weight you should have. So exercises, well, first of all, what it does to the obese people, it reduces the weight. Whenever it reduces the weight, certainly also the pressures go down because overweight demands the heart to work a lot. That means it increases the pressure of the vessels of the blood flow, and it makes now the heart overwork. But also you realize that overweight also has a connection of insulin deficiencies, which now also bring diabetes. So when you exercise, first of all, you're cutting the weight of that person. When you're cutting the weight, you are reducing the overfunctioning of the heart. That
Yes.
means the pressures are coming down to normal. And also, as you're doing that, also the sugar levels are being regulated because whenever you do exercises, metabolism increases. So there's always demand of the body. Yes.
And hypertension?
So
Oh,
hypertension is the blood pressure we are talking about.
yeah, yeah. So,
Yes.
in other words, by just me following intentional exercise, number
Yes.
one, I'm reducing on my sugar levels because the muscles are going to burn out more sugars, and so the reserve that rotates in blood is actually lessened.
Yes.
Number two, but I'm reducing on the fats that can clog the blood vessels, eventually causing high blood pressure or even causing my heart to overwork. So
Yes.
just exercise prevents a trio or actually more diseases. And like I always tell people here that more than 70% of the diseases that are killing us and our loved ones are preventable.
Very.
If there is one thing I've learned from people from the other parts of the world, Charles, is how they take disease prevention serious. At between 4 a.m. in the morning and 5 a.m., you almost find the entire village walking, intentional walking before they go for work. Almost everyone moves with 2 liters of water every day. So
Wow.
this is just a reminder, everyone watching us, that do not wait for your diseases to escalate. Do not wait to go to Uganda Heart Institute and then they tell you your heart is beyond repair. you may not be lucky to have a heart transplant given the cost involved and also the chances of finding a fitting heart. The one thing that is within your hands and control is exercise. We become so busy as individuals in doing things actually. We become so busy sometimes in watching or in doing things that actually dangerous to our heart. I know people who watch TV until they fall asleep. I know friends of mine who are well off that Uriel actually like walks like 2,000 steps a day. Like you said, he leaves the car, he drives to work, he enters his office. Even when he's picking papers from his printer, he moves with a moving chair. So at the end of the day, the body is just there. He does not sweat. There is actually a lady I asked when they last had sweat, and they say, I don't remember when I had my body sweat. Now, you apply makeup every day, you apply Vaseline, the skin pores are clogged, and you know, so apart from cardiovascular actually issues, Charles, what are some other importance of exercise? My skincare doctor told me that for him, he doesn't know any other treatment to bad skin other than exercise. He told me that has been his recommendation for so long. So, Charles, as we go into our viewers' questions, what are some of the other importances of physical exercise apart from the heart and the blood vessels?
Physical exercise has also been proved to be a stress reliever. To people who have stress. It may be marital stress, it may be workplace stress, it may be maybe other issues that are causing stress. Maybe someone has lost a job. So it has been evidenced that physical exercises reduces the stress levels in people. It has also proven that physical exercises boost the confidence of someone. I mean, you've been obese. Now you have done exercises. You are looking good. You are putting your clothes well. You feel confident that you're looking best. No one is going to shun you. No one is going to bully you. No one is going to mock you. So these are some of the key other issues exercise does to someone.
Okay. So we are having some of our questions. This one is saying, which weight is normal for an adult person? If I may ask, how can we go about that question, Charles?
Which weight is normal for an adult? It depends on your height.
Okay.
That's why there is body mass index. Someone should first of all get to know his body mass index. Here we are trying to find the weight against the height, and we see whether you are falling into that levels. As long as you are within the levels of 18 to 25 of your body mass index, that is the normal.
Okay, so how do we measure the BMI to someone that is I mean, I understand body mass index, but how do we measure it?
So first of all, someone must, if you don't have these instruments to measure your weight and your height, you can visit any clinic, any
Okay.
clinic around, and they can tell you these things that you're supposed to do. So how to calculate your body mass index? It just involves you having your
weight?
having your weight known,
Yes.
and having your height known, and
Okay.
then you divide
Okay.
and you get to know the ratio. So that
Okay.
ratio put against the level, the already researched levels.
Reference levels, yes.
Yes, reference levels. There's what we call normal, there's what
Okay.
we call overweight, and then there's what we call obese.
Okay.
So between 18 and 25, that is normal. Then
Okay.
overweight, I think, is between 25 and 30. And then
Okay.
over 30, that one, then you go to obese levels. Yes.
So that also means that there is underweight.
Yes, there's also underweight. There's
Okay.
also underweight.
Okay. Okay. Thank you so much for that. And Mr. Andrew Chamagero is saying I love the high day. He loves it when you emphasize the issue of intentionality. Then his question here is, how do I know that I have over exercised?
Now, the only way you can know is by first of all knowing your body and what your body can cope.
Okay.
If you see that your body may not cope a certain weight, then you are overdoing it. If
Okay.
you see, first of all, also another thing, your chest is reacting in a different way, which is not normal. When you are
Yeah.
overdoing when you are doing a certain exercise, you are going beyond. So you try to strike a balance. First of all, know your body and know what certain exercises can fit within your body. And this body is fun is quite very intelligent. There's a certain level you can reach over certain exercise, and it yearns for more. So you increase it slowly by slowly according to how it demands you to do.
Okay.
Yes.
Um, and again, from another viewer is here is asking, do all cardiovascular diseases need exercise?
No, no. Yeah, not every cardiovascular disease need exercise, because there's a certain cardiovascular disease that may need surgery, that exercise
Okay.
cannot really. There's a certain time whereby the clots are too much, that they first have to do an intervention to reduce them. Then now one of the prescriptions in the rehabilitation phase is that you need to incorporate exercise in part of your management, or maybe a certain food dieting that you're supposed to do. So not every cardiovascular disease need exercise. There are some which may have to go into surgery, some may have to go into those low-level interventions to cater for their management.
Okay. And then she's also asking, thank you, Charles. When do I know that I have cardiovascular diseases? Do you want to say something about this as we close?
Yes, remember we had spoken about three. I had spoken about three types of cardiovascular disease. We have the coronary heart disease, whereby they are characterized by, you may have persistent chest pain, difficulty in breathing. You may be having sometimes overbreathing time and again. All those are red flags that you may be having a cardiovascular issue. In certain cases, you may have wounds in your leg, in your limbs, that are persistent. In spite of you getting all the medications to cater for these wounds, they are persistently there. It may be a red flag that you're having a cardiovascular issue. Maybe persistent leg pain. Maybe you may have calf pains. You never know, you may be having a clot in your blood. All these are red flags.
Okay, Charles. So
Yes.
maybe next time I'm going to invite you to talk about DVTs and actually DVTs mainly, and aortic peripheral aortic diseases. I'll also be happy if you can come along with other a person from Uganda Heart Institute. Charles, Uganda Heart Institute, knowing all this, what have you done to inform our public about the role of exercise and how they can prevent diseases?
One, we have improved our visibility and our vision to tackle this burden of cardiovascular disease through educative forums. We do go to schools and preach this gospel, whereby one of the number one priorities in this gospel is incorporating physical exercise in your lifestyle. We do go to regional hospitals. We conduct sessions there, and even we do screening of patients of those hospitals. We have also gone to corporate places, and we
Yes.
talk to their clients about this burden and how to prevent it, and how essential physical exercises is to preventing this burden. We are
Okay.
also engaging in corporate games, and we talk about these issues. They give us platforms, even on TVs, radios. We are there talking about this.
And definitely, I can also assure you, anytime you have information to pass out, I'm just an email away, and I always give you a space any day, any time from Uganda Art Institute to inform the public about cardiovascular issues, because I believe by giving out as much information as possible, that's the only way we can save the public. I still believe it is more easy to prevent diseases than to manage them. Charles, again, I want to thank you for turning up this morning. Someone maybe is asking, Charles, someone is asking actually before you go, that how comes that each time they hear about people dying in the bathrooms, they are men, that for them, this person has never had a woman dying in the bathroom because of cardiovascular issues. What could be the science behind this?
Statistically, I don't have any evidence that maybe many men die of from the bathrooms, but I would say maybe we find ourselves that it is only men who are having such cases, and like men, we hold a lot. It's just not only about maybe having a bad weight, but also stress levels and all that. They can cause that, to which I believe probably could be the cause of why men are having lots of those heart attacks and dying in the bathrooms. But statistically, I've not yet gotten that information that men are more than women in that. But point in case is that physical exercise does a lot than just managing cardiovascular diseases. It reduces the stress. It reduces the stress a lot.
Okay.
And most of us, we are in a world whereby stress levels,
Zidi one.
they're too much. They're too
Yeah.
much. And physical exercises helps a lot.
Oh, thank you so much, Charles, again. Can you give us your closing remarks on the topic? And then if you had one word to ask the government of Uganda towards exercise and cardiovascular diseases, which message would that be?
First of all, I want to thank all the viewers for this platform, for
Yeah.
me to speak about the physical exercises. Aside being appointed in certain roles to talk about this and to implement this, I'm a big enthusiast in the physical exercise and sport. Why? Personally, I've been helped a lot. It should not just be an option, it
Yeah.
should be an essential factor in your lifestyle. Our brothers and sisters in the diaspora have incorporated this into their lifestyle. One of my bosses in a certain workplace, really, he's coming to, I think, 80, but part of his daily schedule is exercise at least 2 hours. 2 hours. So it should be an essential part of your lifestyle. We know cars help a lot. We know we have pressures at work. We know we have this tag that we are so busy doing this and that. But let me tell you, you are loving those people a lot than loving yourself. One way of loving yourself is helping your heart, your health come to the best level to love others. So I usually put it in my own phrase, even to my colleagues at Heart Institute, that doing exercises, you are loving yourself. You are actually loving yourself more. Because when you are fine, when you're fit, you will make other people be fit. You cannot love others than loving yourself first, as even the Bible instructs us. So I compel each and every viewer that please let physical exercise be an essential part of your lifestyle. Whether you're busy, some of us are so busy, but at least we even put 15 minutes in the morning at 4:30 a.m. I have some certain exercise that I do. I do minimum 50, 100 push-ups,
Wow.
100 sit-ups,
Wow.
100 squats,
Wow.
100 jump jacks. All those,
Wow.
at least, because I program myself. We are so busy, but we need to love ourselves by putting a certain time for this cause to avoid all these cardiovascular disease. I also compel the government of Uganda. Already they are doing it. but let them increase the intensity of it. Let them make it so intentional, mandatory, that all the government workers have a certain exercise they do. That I'm trying to advocate for a policy in our at Uganda Teams, that each and every staff at least has a certain time, and these times should be monitored, that you're doing certain exercises.
Wow.
Yes.
Thank you so much. Thank you so much, Charles, for this wonderful information. Maybe lastly, on behalf of the CEOs, what can the CEOs do in 1 minute to make sure their employees actually engage in these activities? Because the corporate world is actually tends to suffer more from cardiovascular disease, and they also have the busy syndrome.
Yes.
So what can the CEOs do, or people that are working in the corporate world, or people that are working in organized environments? What can they do?
CEOs
Yes.
CEOs are policymakers
Yes.
in their different situations. So try to make it a point that you bring a policy that will implement this physical exercise. But you just don't want to implement a policy without you being the first advocate. So you have to walk the talk. You have to
Yeah.
walk the talk. Our ED at Heart Institute walks the talk. He comes for these exercises. He does them, and a CEO is like a priest, a high priest in his institution. What you do, other people will follow. So the simple advice is, you're a policy maker, make a policy that will implement this, but also walk the talk.
Actually, my friend Flavia just reminded me that they have just commemorated the Physical Activity Day. So, again, maybe to add on what Charles has said, where I practice from, recently, actually, every quarter, we have a month where we have an app where all of us must walk a certain distance every day, and then you must show evidence that you whatever, either by a watch or by a phone. So there are apps on your phone actually that you can use when you're walking. You just go to Google Store, and then you can look for apps like Step Tracker, apps like Google something, Gemini Step Tracker, apps like Runner, something. These are going to tell you how many steps you whatever. So you can actually have a book where you record them. So as policymakers and CEO, again, you can have these like once a week, a month. You tell people the first week of a month, everyone must show us evidence that actually they are exercising, but also engaging in corporate leagues, having your organization register for maybe sports days or corporate leagues, such that once a quarter they go and meet out with other people and they exercise their body. I also have a friend of mine who works in one bank that told me every Thursday they were bringing now instructors to help workers to at least exercise that. I think those are some of the things that we can engage the so-called busy corporate people, because if not, be willing to give them most days of sick leaves when they fall sick. So to keep your company going, you need health people, and to keep people healthy, there are things that we must actually learn to start doing. So Mr. C. Ocha Magero Andrew, wherever you are, it's time to engage those people to start engaging in more physical exercise. So again, I want to thank you, Charles. I want you to send regards to your workmates, to your family, as we close off the program today.
Thank you so much. My best regards to all the viewers who have been with us today to hear this information. Little information is crucial to at least build a certain level of knowledge base that can help you. I send my shout outs to my wife, my children, my colleagues at Heart Institute, and everyone associated with me. Thank you so much.
Thank you so much. We shall have you again, I think, in the month of September, if you are available. And the topic of discussion will be DVTs. I shall look at imaging, detection, and what to do, because people need to know. People need to know. Again, thank you so much for your time. I want to thank all the viewers that have turned in today. I thank you so much for reserving your time and spending it with us here. Again, if you're here and you've not subscribed to this channel, please subscribe and put a notification button so that you don't miss anything. We come here every Sunday morning with different experts to share knowledge with you because we believe prevention is better than cure. Again, today my reading is coming from the book of reading it is coming from the book of 1 Corinthians 6, 19 to 20, and it says, do you know that your bodies are temples of the Holy Spirit? Therefore, honor your God with your body. My name is Mr. Selfcare, and I want to remind you that it is your responsibility to take care of those bodies. You're supposed to be a good steward of those bodies. Do not let them fall sick for things that you can actually control. I want to thank you, and I send regards to everyone that turned up for Local Football Appreciation Awards, especially my mentor, my best person, Coach Mike Mutebi, Mr. Ali Tom Sange, Ajabas Kawasa, Haj Hud Hassan, Mr. Mujibu Kasule, Mr. Mparanyi Sentongo, Mr. Ali Leng, the son of the late Patrick Luandaga, Otai, Mr. Egesa, NTV, NBS, all the media houses, FUFA Media Services, and all Uganda Fan TV, UPL Fan Meetup, and everyone that turned up for that, for Local Football Appreciation Award ceremony at Rivonia. Thank you so much for loving the soccer contributors in the country, and thank you so much for watching this channel. Again, from me and my family, we send you love. But in a special way, I send my greetings to my daughter, who I know is watching. Thank you so much. Dad loves you so much, and all my family and friends. From me and everyone in our studios, have yourself a blessed Sunday. May God bless you. See you next Sunday. Bye.